My name's Dr. Lorraine Gordon. I'm a consultant counselling psychologist, and I've worked in the NHS for over 20 years, but also I work in private practice. Of real concern is that, some of our service users and carers don't have the connectivity that we need them to have in order to be able to keep those relationships going. They don't have smartphones, they don't have access to the internet, and it's been a particular problem for some of our refugees and asylum seekers who don't have recourse to public funds, and just, there's no way they're going to have those things. So we've tried to, use grants and things like that to help them, but it is a gap, and there's a real risk of digital exclusion continuing as the pandemic in this kind of continues. As people say, it's a marathon, not a sprint, so it's kind of the long haul, and we need to be adjusting over that period of time, thinking about new ways of working, that making sure that we're not excluding people, actually, particularly our most vulnerable people who find themselves in poverty and are deprived. I can't separate at the minute the disproportionate impact of Covid-19 from the Black Lives Matter movement and George Floyd, the murder, racialized, brutal murder of George Floyd in the US, and actually those things coming together have really shown the structural inequalities, the social determinants of health, just the fact that for years, for decades, we've watched people have, from ethnic minority groups, have poorer access to treatment, poorer experience when they're accessing treatment, and poorer outcomes. They're much more likely to be over-medicated, much more likely to be sectioned, much more likely to be secluded, restrained. All of these things that really need to change. So I was, before Covid-19 and before the brutal murder of George Floyd, I was trying to make a difference in that area, and I'm not the only one. I know there are several other people like me trying to do that, but really those incidents kind of happening together, just made it impossible to ignore. What this makes me think of is how stressful it is, and how it's just another stress on top of the racial trauma that often people that look like me and our Asian colleagues and clients have faced their whole lives, which is what makes us often more susceptible to mental health problems. It's the racism in society that increases those numbers, because if you look in the Caribbean, we're no more likely in the Caribbean to, than the white population here to experience mental health problems. But put us in this environment because of the stresses, then we're way more likely to be diagnosed, and so on and so forth. So I think, mental health and awareness of how it affects us is an ongoing concern. And I think, a way to address that is to really be building our resilience. Part of that, as I was hinting at before, was about telling our story. We're in Black History Month, and actually we get a chance now to hear, the achievements and the contributions that Black people of African and Caribbean descent have made and contributed to British society over the years. And it shouldn't take for a Black History Month to be doing that, but actually we are people who are resilient, we're people who are successful, we are people who can achieve things, and so it's kind of building on those strengths. So I'm just saying, because the stress just builds on this load on people, and it's really about finding positive ways of dealing with that. So some people will have a faith that they can draw on, some people will be creative in terms of that, singers and things like that they can use as an outlet. But what we really need to be doing is supporting one another through it. So I think that's what we need to be doing